Hey guys, Dr Davin Lim, board certified dermatologist. Today we'll be talking about five bang for your bucks treatments. Now, with this, I take into consideration everything that you can do to your skin, from facials, massages, all the way to creams, topicals, chemical peels, lasers, energy devices, surgical techniques, and all the devices out there, yeah, including home use as well as professional. So yes, you could say it's a little bit biased because I'm a procedural dermatologist, but the flip side is that I'm trying to be fair and trying to actually outline what creams can do and what procedures can do. So let's set the budget. So the budget will be between $400 to $500, yeah? So you've got $400 to $500. Are you going to blow it on the skincare range and see whether you can get results in 4 to 6 months? Or should you try some procedures? Now, having said that, this list is compiled by both myself, but also asking my therapists and nurses in regards to their favorite procedures. I've given them the same outline. You can have between $400 to $500 worth of retail, as in retail creams or retail procedures. So here it goes. The first thing I think bang for your buck. So I'm doing this in order. Number one, chemical peels. You can't go past a chemical peel, especially a chemical peel which is provided by a specialist or a clinician or an esthetician. Now, the reason why I'm saying that is when I look back and go, look, if someone's going to spend $400 on a whole heap of skincare, whether it be alpha hydroxy acids, beta hydroxy acids, the actives, CE ferulic acid, etc., retinoids, retinol, the whole lot, yeah, can they get the same effect as, for example, so 4 to 5 months of medium end topicals compared to 4 chemical peels? It's a unanimous vote between myself and all my nurses and therapists. Everyone would go for peels. The flip side is, what peels should you consider? Peels generally start at around $80, and yes, they can go up to several $100s, but most of the clinical peels that dermatologists do, they usually hover around the $80 to $100 mark. And depending on your skincare concerns, there are many peels. AHA, alpha hydroxy acid, which include glycolic peels, lactic acid peels. They start, like I said, between $80 to $100. And then there's retinoid peels. So retinoid peels start at something like 0.5% retinoid. So it's very different compared to your retinol. It's at least 100 times stronger, even more. And then it goes up to about 2%. And we've recently got the 4% retinoic acid peels. So, you know, they actually do give a good peeling, yeah, compared to at-home use. And then salicylic acid peels. So we start off with something like 10%, 15%, go up to 20%, 30% salicylic acid peels. So if I'm going to rank which is the best bang for buck, excluding TCA, because TCA medium depth, I think it's probably look, in Australia at least, that's usually performed by specialists. Yeah, so let's exclude TCA for the time being. We talk about superficial peels, which superficial peels are within your epidermis, right? So I think bang for buck is probably retinoic acid peels. Reason being is that with AHA peels like lactic and glycolic acid, you got to start low. So you start something like 15%, 20%, go up to 35%, 50%, then 70%. And most of the time you see your changes between 50 to 70%. But for retinoic acid peels, generally speaking, if you don't have sensitive skin and no contraindications, we can start pretty high. So we can start at something like a 1% or even 2%. And generally speaking, if you have things like pigmentation or fine wrinkles or congestion, enlarged pores, generally speaking, with between 2 to 4 treatments, you should see a noticeable gain in your skincare aims. Yeah. So I still think that peels, chemical peels, if you sink in between $200 to $400, you should get a pretty good result. Okay, so moving up from there, what else can we think about? I think number 2 is fractional laser. So you say, hey, fractional laser costs a lot. Let's exclude CO2 laser. Let's exclude things like Fraxel, but let's consider things like mini fractionated lasers. So things like Clear and Brilliant, for example. Clear and Brilliant, it works very similar compared to a Fraxel. You're using a 1927, it's diode driven rather than thulium driven, and the energy is very low. Yeah, so it's about a quarter the maximum of what a Fraxel can do. But it's also more cost effective. So I think if you have a look around, most people charge between $400, even cheaper, $350 to $400, $450 per treatment for Clear and Brilliant. But look, I know what you read. So you read and they say you need at least 4 treatments or 3 to 4 treatments. I do believe that if you use it off-label, basically you've got the card's got energy. If you do the passes where you're bothered, for example, if you've got crow's feet and you're bothered about wrinkles, you concentrate in that area. If you've got pigmentation, you concentrate in that area. I think one treatment done properly, bespoke, will give you better results compared to 3 to 4 months of topicals. The exception obviously is melasma, because obviously with melasma it's not procedural, it's actually medical to begin with. So let's exclude that. But if you're talking about normal pigmentation, fine lines, wrinkles, pores, I think a fractional laser done properly can give you a very good outcome. So number 3 is this. Okay, if you do have wrinkles, I do think that a muscle relaxant will be great. Especially with your crow's feet, because crow's feet, generally speaking, we don't have to put much units in there, right? We're talking about Botox, but there are other cheaper muscle relaxants compared to Botox. So in the US, in Australia, there's Xeomin and also there's Dysport. So basically, a cost price for Botox, if you don't know, in Australia is around $600, including GST, $650 including GST for 100 units. You can convert that to the US. Yeah, it's probably about half of that, as much with the dollar now. But look, if you're having Dysport, if you're having a Xeomin in this area, and if you're only using 6 units in there, it's very cost effective, because if you think how much cream do you need to actually use to get rid of the wrinkles? A lot. And the other thing as well, the cream probably won't work. So if you're sinking in probably $120 or $140 around your eye area, you're going to get a result. The other thing as well is your frown lines, certainly they need more units than that, but your mentalis, so people with crinkly chins, or if you've got scarring around your chin area, sometimes, when we're talking about Botox units, between 4 to 6 units around this area to relax your mentalis can make all that difference. So I guess in this economic, I wouldn't say crisis, but in this economic situation of what we're in at the moment, things like muscle relaxants can make sense, because it's shelving up basically $100-200, and it can make you feel good between 4 to 6 months. It's not going to last forever, but if you think you're actually spending that much on skincare and you're not getting a result, maybe muscle relaxants may be the way to go. Certainly dermal fillers, they last longer, so you've got to actually invest more. But the flip side is that they last anywhere between 12 months upwards to 3-4 years. But once again, that's a higher expenditure. So let's just concentrate on muscle relaxants. Number 4, okay. Number 4 is this. I don't do it. I see it. I respect it. It's eyebrow Feathertouch tattooing, or cosmetic tattooing using the Feathertouch technique. One of my nurses is very good at it. She's a perfectionist. When I used to do the eye rejuve, whether it be laser or fillers or energy devices, I still think at the end of the day, your brows make a lot of difference, because it actually frames your eye, frames your orbit. So I think for that expenditure, you're spending anywhere between $400 all the way up to, for really good tattooers, all the way up to $900. But that generally lasts you between 9 months all the way up to 18 months. And it makes a difference. It's an instant wow, yeah? And I think it is actually a procedure which I respect a lot. There's a lot of art to it. There's a lot of technique. There's a lot of style. And I thoroughly respect the tattooers who actually can perform that and give a wow factor, because it really puts the icing on the cake compared to what I do. Yeah, so I basically just rejuvenate, but they actually put the volume as well. So sometimes combining fillers in the brow area together with Feathertouch really gives you a wow factor. And they do need to be repeated, but if you think about how much it costs to be repeated, for example, 12 months later, most people charge anywhere between $180 to $300 for that repeat. So I still think that's very worth it. Now, number 5, this is controversial. I do it. I mean, I'm noted to be, I wouldn't say against it, but in the comparison to lasers, microneedling itself still plays a role. I still use microneedling 2 to 3 times a week. But that's mainly not for CIT, which is collagen-induced therapy. But I use microneedling to actually get down into the dermal layer to deliver certain actives like corticosteroids, especially for scar revision and hypertrophic scars. So CIT, collagen-induced therapy, microneedling, that's my number 5. Reason being is that it makes you feel good. Patients actually report it actually feels very good. They get an improvement in skin texture. And overall, they're pretty happy, yeah. And sometimes it can actually help with fine lines, wrinkles, and the cost for that is, look, generally speaking, between 150 all the way up to 450. So we're not talking about RF microneedling or RFM. That's different. That uses a device. So with all of these procedures, I mean, there's a general trend, apart from fractional laser, there's a general trend that most of these do not have consumables. So that's why these little hints can give you a good amount of skin rejuvenation for a low cost. So once again, it depends not only on the procedure itself, but who's doing it, because there's you know, especially for chemical peels, yeah, there's a very, very fine art in regards to that. In preparing your skin, for example, whether it be an acetone scrub or whether it be a clarisonic, whether it be a physical exfoliator, to give you that oomph, to give you that extra, power when it comes to the chemical peel or the chemical used. The same goes for laser resurfacing, because if we're using something like Clear and Brilliant, yes, I know the the guidelines say do 2 to 4 passes, but if someone knows what they're doing, we can well exceed that. Anywhere between 8 all the way up to, believe it or not, 30 odd passes in the correct setting. Yeah, in other words, in the correct skin type. In the correct condition. Obviously, you don't do that in someone's darker skin type, nor do you do that in someone who you think you may have melasma. So once again, everything's got to be taken into context. And I think these 5 things are actually bang for your buck. Guys, I hope you liked this video. Please like, comment, share, and chime your thoughts below. I'll see you next week. Bye for now.